Medicaid expansion is once again being proposed for the state of Wyoming, and we've had a lot of discussion about that here on this program. Well, good idea is to get everybody together for and against and sit down and have just an open, honest discussion about expanding Medicaid and bring in experts not just from around the region but from all over the country. We had a call earlier this morning from Dr. John Mansell, who's been driving up from Colorado to get to the conference by Wyoming Liberty Group. Naomi Lopez is with the Goldwater Institute. Are you based in Arizona, Naomi?
Yes, the Goldwater Institute is based in Arizona. I actually work from my home in Illinois because I work in all of the states.
Okay. That's good, because I was about to say, if you had to leave Arizona and come on up to the cold here, but if you're in Illinois, this is probably an improvement.
Yes, it certainly is.
Okay. So as Wyoming Liberty Group contacts you to come in, what was the discussion there? Were you writing about it, speaking about it? Why would they bring you into this conference?
Well, I've done research on what happens after a state expands Medicaid. In Arizona, we found that despite all the claims that Medicaid expansion was going to help rural hospitals and really, I think provide the kind of care that I think that everyone wants, low-income individuals to have. What we found in our studies, we used two different data sets that looked at hospital admissions and also charges. What we found is that after Medicaid expansion in Arizona, hospitals tripled their charges on Medicaid patients coming into the hospital, those that were not admitted, those that did not have to stay. And they dramatically increased charges across the board, actually. And since we put out our study, Colorado has found the same, and we've also seen that in other states as well. And so one of the really big concerns is, does Medicaid expansion actually get those dollars into actual care for patients in the way that they need it? And, there are a lot of concerns about expansion. For example, handing out a lot of Medicaid cards doesn't mean that someone's going to be able to make an appointment and see a doctor and have a regular physician care for them. And the reason is that Medicaid reimbursements are very low, and many doctors do not take new Medicaid patients. So, we need to be very thoughtful about how we approach health care, particularly government health care, especially with the rules and regulations that really bind you and what you can actually do to serve those individuals that you're trying to help. So, I think that there's broad agreement that we want people to have accessible and affordable health care. But the real problem comes in, whenever you start talking about the details and the unintended consequences. For example, in every state that's expanded Medicaid, enrollments have shot through the roof, far higher than anyone estimated. Well, there's probably a couple of good reasons for that. One is that people are dropping their private coverage and going on Medicaid. It's not that Medicaid is an exceptionally good program, but it's free. And so, you might be estimating that 27,000 people are going to get coverage, but the reality is that it's going to actually be quite a few more. And the real problem with that is that states are now running into budget shortfalls as a result, because the enrollments have completely eclipsed what they originally expected. So, for example, New York now is dealing with billions of dollars in shortfall as a result of so many people enrolling in the Medicaid program. And the real cruel part of the Affordable Care Act that no one seems to talk about is that the expansion population, primarily healthy individuals who are healthy enough to work, are reimbursed at about 90 cents for every dollar the state spends. So let's say a state spends $1 on health care, the federal government will give $9 for the care for the expansion population. Now remember, these are people who could work, who are healthy enough to work, or could contribute a significant amount to their health insurance. The original Medicaid population, those that are poor, many who are disabled, medically vulnerable, they're reimbursed at about $1 for dollar. So every dollar the state puts in, the federal government puts in $1. Well, now that New York is looking at a budget shortfall, guess what the concern is? The big concern is that services are going to be cut for the most vulnerable, for the truly needy, for those who are not able to work in many circumstances. And so that is a real cruel aspect of the Affordable Care Act, is that states have an incentive to cut services for those who need it most.
Naomi is my guest from the Goldwater Institute. You're in Cheyenne right now?
I am.
Okay.
Yes, and we're going to be having a conference today.
Okay. Now let's take a look at, with your knowledge here, maybe you can help me debunk a few things. Someone wrote a piece that was supposed to be a news article, but it was really an opinion piece, Naomi. And, of course, it was shared like crazy out there. And it said, let's take a look at Wyoming. As you know, landmass-wise, this is a big state. Yet, population-wise, it's the smallest state. So you can imagine how spread out our hospitals are. And the article said rural hospitals go out of business if they don't expand Medicaid. And my answer is, I think that they would have gone out of business whether they did or didn't. But you tell me, is that true?
So the rural hospitals are going out of business, unfortunately, and there are a lot of different causes. But I can tell you that Medicaid expansion does not save rural hospitals. In fact, what we've seen in some states is because of the way that the funding formulas work under Medicaid expansion in some states, rural hospitals actually get shortchanged by the program. And think about the market power of the larger hospital chains. Think about the fact that medicine is also changing, and there are a lot of complicated reasons. But anyone talking about Medicaid expansion saving rural hospitals is either very uninformed or is being dishonest.
I think they have an agenda. But, okay, here's one I got. This is from a Wyoming-based group that's for Medicaid expansion. And they put a little flyer out there. So I'm just going to run down point by point. Because, again, I could have done this, but I'm thinking you're a lot more qualified to answer what they have to say. Who is Medicaid expansion for? Frequently asked questions. Medicaid expansion provides essential health care to people who work at jobs that don't provide health insurance and who can't afford to purchase health insurance on their own. Now, that would be correct, right?
So we know that state after state that's expanded Medicaid, what happens is that this population will actually drop their private coverage and enroll in Medicaid.
Right. So why should a private business pay for health coverage when they can just dump their employees on Medicaid?
Or the employee is making a rational decision too. I mean, why should they spend their hard-earned money? So it really is. It really does provide an incentive, and we know in every state that expanded Medicaid, the number of people enrolled in Medicaid is far higher than what they were anticipating, and this is a big part of the reason. It's because people are dropping private coverage and enrolling in Medicaid.
Okay, so the next one is, what is the match? And I think this is pretty easy. You just addressed this, but let's take a look at this. They say Medicaid expansion provides a 90-10 match for federal government Medicaid expenses. For every 10 cents we spend, we end up with a dollar flowing into the Wyoming rural hospitals. I know that's not true.
So all of the money doesn't go to the hospitals. I mean, first of all. But second of all, think about what happens when there's a budget shortfall. Where are state lawmakers going to be tempted to make cuts? Where they're getting a dollar for dollar, or where they're getting $9 for every dollar? The real cruel irony of expansion is that in a budget shortfall situation, which it's not if, it's when it's going to happen, it happens. We have economic downturns from time to time. The services for the most vulnerable, those who need it the most, are going to be cut. That is cruel. It is bad policy. It goes against everything that we think should be we think we should be providing. Of course we want to help people who are the most vulnerable, who cannot obtain health insurance, who cannot work, who have very medically complex health situations. So why would we want to fall into that trap of getting into a situation where you're just chasing dollars and not really thinking through what the impact of doing that is going to be on those who are most vulnerable, who you claim you're trying to help.
Okay, so let's attack it this way then, because it's fine to sit here and say, well, all right, there are these people who they need to see a doctor, they need to go to the hospital, they can't afford it. We all really want to help those people. But we're looking at Medicaid expansion, you and I, and saying, but that's not going to work. Okay, if not that, Naomi, then what to help these people?
So there are several state-level reforms that you can take to lower the cost of health care. You can reduce mandates on insurance policies and other government regulations to make health insurance less expensive. You can, and that way you would have a lot more options that would better suit people's needs. You can also repeal what are called certificate of need laws, which basically require hospitals to go and ask their would-be competitors for permission to open up a facility. That would be helpful too. You can also look at other programs that would help to subsidize individuals who perhaps need some help, but who don't need to enroll in Medicaid in order to get health care. Maybe they just need a subsidy, for example. And so I think that there are other alternatives and avenues that we can look at and pursue that really do address the actual issues of access and cost, as opposed to a one-size-fits-all program that is going to have a lot of detrimental effects, that's going to, I think, really undercut the true objectives and goals of what you're trying to do in order to help the most vulnerable. And so I think the idea that it's Medicaid expansion or nothing is completely false. It's a false choice. There are a lot of other reforms that one could take, and there's actually other federal money that states could pursue. There's something called a low-income pool that some states have pursued, and instead of Medicaid expansion, which actually helps pay for insurance for low-income individuals. So there is no such thing as Medicaid expansion, or you're not going to do anything to help anyone. There are a lot of alternative pathways that should be examined that I think would do a much better job in actually meeting the needs of individuals who in many cases do want health insurance, but they're not able to afford it for a variety of reasons. Look at those reasons. Look at the ways that insurance regulations are driving up the cost of those policies. Look at the issue on the supply side. What can a state do to get more providers, mid-level providers, for example? Not everyone has to go to an MD. If you have a throat infection, ear infection, something simple, a nurse practitioner can see you, and then you can be referred if it's something more serious, of course. But there are a lot of different approaches. And the idea that there's some kind of silver bullet in Medicaid expansion to fix to fix this is complete nonsense, and we know it's nonsense because state after state after state around the country that's expanded Medicaid, they're facing the same issues: over enrollment, budget shortfalls, increased charges from their hospitals. I mean, it really is something that there's enough evidence to really debunk the idea that Medicaid expansion is going to save the state's rural hospitals and provide high-quality access and affordability for people.
Naomi Lopez will be part of the Wyoming Liberty Group discussion tonight in Cheyenne, Wyoming. So it's a panel discussion. So who else is on the panel with you?
I'd have to look that up, but there are. It's going to be a very thoughtful, engaging conversation. It's a lunchtime discussion, and it's going to be moderated by a PBS Wyoming host. And so I think it's going to be very, it's going to really dive into these issues, and from a standpoint of really taking a deeper dive into the issues, talking about what the actual goals are, what the experiences in other states have been, and both sides will be well represented in this discussion.
Sounds like a good debate. I look forward to hearing, because I know that they're going to go ahead and post this afterwards, so I can hear what you had to say about it.
Yes.
Thanks for coming on and helping us out with this topic. I appreciate it.
You're welcome.